82-year-old female with a history of melanoma in situ as well as a history of non-melanoma skin cancer, and she presented with an 8mm enlarging brown macule on her left cheek. A biopsy was performed, and it showed a broad and subtle lentiginous melanocytic proliferation on heavily sun-damaged skin. A MART-1 stain was used to highlight the melanocytes, and it showed crowding of single melanocytes at the dermal-epidermal junction, and also a focus where there are 2 or 3 small cells clustered together, possibly forming a small nest. PRAME staining is negative. In this case, I'm between a solar lentigo with slight melanocytic hyperplasia due to chronic sun damage. That's the phenomenon termed actinic melanocytic hyperplasia. This is a benign reactive change in sun-damaged skin that can happen versus melanoma in situ, lentigo maligna type, or a precursor lesion to that. Features that are concerning here are the crowding of solitary melanocytes in a broad lesion on sun-damaged skin. A dogma in dermatopathology is that a broad junctional proliferation on sun-damaged skin is melanoma in situ until proven otherwise. The presence of small nests is concerning because melanocytic hyperplasia, the benign reactive phenomenon, usually doesn't result in nesting. Nesting implies a true melanocytic proliferation, which again, when broad, would be considered highly atypical on sun-damaged skin. I could term this an atypical junctional melanocytic proliferation, which is my preliminary diagnosis. But if I do this, the vast majority of providers would treat this as for melanoma in situ, with a wide local excision or a stage excision that would result in a large defect and a repair on her face in an 82-year-old near her eye. I would love to step away from the possibility of an early melanoma as much as possible, and ideally see if we can get away with just observing this lesion. And for this reason, I sent it to MyPath rather than just calling an atypical junctional melanocytic proliferation. The MyPath result came back with a score of a negative 4.9, which is suggestive of a benign neoplasm. So my final diagnosis here, with the attached molecular results, is a solar lentigo with slight melanocytic hyperplasia. I reviewed the photos and it's part of a broader lesion, so I would recommend clinical follow-up with considering additional biopsies if there's growth or a change in the pigment pattern over time that suggests evolution. I can't know that this lesion on sun-damaged skin won't evolve over time, but at this point in time, I can reassure the provider that it seems to be behaving on a molecular level in a benign fashion, and it's okay to just monitor. And so this patient did not have surgery and is being monitored.